Hello, how are you?
Good, how are you?
Good. My name is Marie. I'm going to be your nurse today. What is your name?
Bernadette.
So nice to meet you. Your last name?
Fisher.
Okay. Can I call you Bernadette or
Yes.
Fisher? Okay. Miss Bernadette, like I said, my name is Marie. I'm going to be your nurse. And what are you here for today?
Just an annual physical.
And your physical? Okay. Today we're going to be checking on the neurological system, okay?
Okay.
I'm just going to ask you a few questions first, and then we'll go through and do the entire assessment. I'm going
Okay.
to use different things, and I'm going to ask you to do different things. If you feel like you're getting tired or you're a little bit out of breath, just let me know and we'll stop, okay?
Okay.
All right. All right, first question. Do you have any unusually frequent or headaches, sorry?
No.
Ever had any head injuries?
No.
How about dizziness? Ever feel dizzy?
No.
Ever had any convulsions?
No.
Any tremors in your hands or your face?
No.
Any weakness?
No.
Any body part at all weakness?
No.
Any problem with coordination?
No.
Any numbness or tingling anywhere, fingers, toes?
No.
Any problem swallowing?
No.
How about speaking?
Nope.
Any past history of stroke,
No.
spinal cord injury?
No.
Okay, good. Do you experience or have you experienced any environmental or occupational hazards?
No.
Okay, very good. So like I said, we're going to start off with using a couple of things. I'm going to ask you some questions. I'll have you perform a few things. You just let me know if you're feeling any lightheadedness, dizziness, tired, and we'll stop, okay?
Okay.
All right, I'm just going to wash my hands. Okay. All right. The first thing I want to do right now is just test your cranial nerves.
Okay.
What is your name again?
Bernadette Fisher.
Bernadette. Your date of birth, Bernadette?
9/28/82.
Do you know today's date?
December 8, 2013.
What time zone are we in?
Eastern.
Okay, very good. You're alert, awake, oriented times 3. I'm just checking to see your alertness and how you react, okay? Right now, I'm going to ask you to close your eyes for me, and I'm just going to give you 2 things to smell, and you tell me what it is that you're smelling, okay? This is the first one.
Mint.
Okay, very good. And this is the second.
Peppermint.
Peppermint. The first one was peppermint, and the second one was?
Mint.
Okay, very good. Thank you. Now, you're able to identify odors in both nostrils bilaterally, so that is good. Now I'm going to be testing your visual field, if that's okay.
Yeah.
All right, I'm just going to take the pen light and flash in there and take a look and see. You just follow my finger. Very good. Okay. Pupils are equal, round, reactive to light and accommodation. Very good. The next cranial nerve I'm going to be testing is 4 and 6 actually. And this is the one where I'm going to ask you to take a look and see. I'm going to ask you to cover your left, and I'm going to cover my right. Now, what I'm going to ask you to do is tell me when you notice the target. I'm going to put my hand up, and that'll be the target, and you just tell me when you notice it. Okay? I'm going to start moving.
See it?
See it now?
See it? See it?
Good.
See it?
Good. All right. Now, clench your teeth for me. Right now what I'm doing is I'm checking the trigeminal nerve. Okay. Equally strong on both sides. Can you just open your mouth for me? Good. I'm feeling for the temporomandibular joint here. Equally strong on both sides. I don't notice any weakness. I'm going to ask you to close your eyes for me. And I'm just going to touch you with this end of the cotton tip, and you tell me where you feel it, okay?
Forehead. Nose. Left cheek. Right cheek.
Okay, very good. That was just testing the sensation to make sure you have sensation equally in all areas. Now, can you smile for me? Frown. Lift your eyebrows. Puff your cheeks. All All right, very good. Testing the facial nerve. I don't notice any weakness, no drooping, no sagging on any sides. I see symmetrical movement on both sides. Okay? Now I'm going to tell you 3 letters and numbers. And you repeat to me what I said to you. Okay?
3L7.
Very good. That is testing the acoustic nerve. And now I'm going to ask you to please open your mouth. Say ah. Okay, very good. Uvula and soft palate rise in the middle, and voice sounds smooth and not strained. So I was just checking the motor function and cranial nerve number 9. Now, I'm going to ask you to please shrug your shoulders. All right. Now, try to resist me from okay, very good. All right, very good. Equally strong on both sides. Spinal accessory muscles are equally strong. I was testing for cranial nerve number 11. Now I'm going to inspect the tongue. Stick your tongue out for me one more time. Okay, up, move it up for me, move it down. Can you do from side to side? Very good. Can you say the words light, tight, dynamite?
Light, tight, dynamite.
Very good. Speech is clear and distinct, and I was testing the hypoglossal nerve. Right. Now, if you can please stand for me for one moment, I'm just going to be checking for muscle tone and movement. I'm going to ask you to just take a little walk for me. All right, turn and go back. Very good. Moves with sense of movement. Gait is smooth, rhythmic, and effortless. Opposing arm swing is coordinated, and the turns are smooth, which is exactly what I'm looking for. Now, can you please stand right here for me? I'm going to do the Romberg test. Stand with your feet together, arms at sides. Close your eyes, and just hold your position. I'm testing your balance. Very good. You can open your eyes now. Maintain posture and balance with visual orienting information blocked. Now, can you please bend your knee? One knee for me. Stand on one. Yes. Now the other. Very good. Alrighty, good. Normal position says you have good muscle strength and cerebellar function. Now, can you please touch your thumb to each of your alternating fingers? Quickly. You can go backwards. Very good. Equal turning and quick rhythmic pace at both sides. Very good. Now, can you have a seat for me? One more time. I'm going to be using a dull point and a sharp point. This is sharp. This is dull.
Okay.
Now you tell me, where do you feel and what do you feel, if it's sharp or dull.
Okay. Sharp forehead.
Good.
Dull chin. Sharp left arm. Dull right hand. Sharp right inner elbow.
Very good. All right, good senses. They're within normal limits. All right, now I'm going to be using a cotton swab, and you tell me when you feel the touch of the cotton swab, okay?
Forehead. Left arm. Right hand.
All right, very good. Able to detect this position sense. All right, now I'm going to do another test, and this will actually tell me your position sense also. I'm going to move your finger in a direction. You tell me which direction I'm moving it to.
Up. Down. Left. Right.
Very good. Able to detect position sense bilaterally. Let me make sure.
Up. Down. Left. Right.
Very good. All right. This test is going to be a tactile discrimination test. I'm going to place a couple of objects in your hand. This is testing for stereognosis. You tell me what it is that is in your hand. Close your eyes for me.
Key.
Okay. Very good.
Hammer clip.
Very good.
Coin.
All right. Good. Fine touch is in within normal limits. Tactile discrimination, of course, you did that without any dysfunction. That means the parietal lobe is functioning perfectly. Now, I'm going to use this little N and I'm going to trace a letter in your palm. You tell me, actually a number, and you tell me what number.
6.
Okay, very good. That's testing for graphthesia, okay? Now, I'm going to be testing the reflexes. There are certain movements I'm going to do. I'm going to use this instrument, and with this instrument, it'll just tell me whether the reflexes are within normal limits or not. If you feel any pain, you feel any discomfort, you let me know, okay? First, I'm going to test the bicep. Okay, good. Normal contraction of the biceps muscle and flexion of the forearm. Now, let this arm go dead for me. I'm going to be testing the triceps, okay? Okay. Normal extension of the forearm. The brachioradialis. Let me use this one. Okay. Normal flexion and supination of the forearm. The quadriceps, which is actually the knee jerk. This is the one that's going to test to make sure that you have good function of your knee jerk reflex. Very good. Right. Within normal limits bilaterally. Now, Achilles, tendon, reflex, hip rotated forefoot. Okay, that one I'm not going to test. I'm going to ask you to lie back for me. The abdominal, just going to do a light touch here, and you tell me. Right, very good. All right, contraction of the abdominal muscles, which is normal. So sit up for me. All right, now we're going to take the patellar here. That's a flexion of the toes. Is it okay if I take your shoe off? Very good. All right, very good. Good. Normal plantar flexion of the toes and inversion flexion of the forefoot, which is normal. So this concludes our neuro assessment. Do you have any questions for me?
No.
Okay. I just want to let you know to make sure that you follow up with your primary care physician if you happen to notice any changes in your reflexes or in your joints.
Okay. Thank you.
Alrighty. You're very welcome.